Unpopular thought. The way that doctors have been trained to think is the reason why there are so many people struggling with chronic illness. Doctors are trained to see things as black and white, but sickness is gray. They're taught to provide a diagnosis based on labs and offer treatment that was taught to them by their textbooks, senior doctors. They were never taught to be open-minded. It's ironic that healthcare spending is at an all-time high, but so are the number of people who can't get answers and have to settle for their healthcare providers shrugging their shoulders. This poster says, "I have so many thoughts about this, LOL." Their biggest issues they've run into are doctors see a patient through a limited scope, similar to that old parable about blind men and the elephant. Specialists are necessary and important, but so much time is wasted being sent to multiple places for each issue and leaving with basic symptom management, usually in the form of add this new medication and let me know how you feel in a month or so. Sometimes illness really is that simple, but healthcare just doesn't seem to be built for anything more complex. Chronic illnesses usually involve multiple symptoms in multiple areas of the body. So at some point, a doctor, especially a general practitioner, has to realize that the patient has been to several specialists and maybe found relief, but at what cost? Now the patient has to keep up with several different medications, follow-ups, testing, labs, just to maintain relief. This person feels as if they're constantly spinning plates and having to put so much energy into keeping a delicate balance that took years of guesswork and treatment before any solid answers. This person says they can't get a general practitioner in their area and no sign that that will change. They've been diagnosed with endometriosis, yeah, I know. And they wonder if the only thing that's going on is just that diagnosis, but no one is willing to investigate further. They wish that they had doctors that would specifically focus on chronic illnesses. Most doctors want you in and out as fast as possible. True. They said some solutions they would like to see are more doctors who actively listen to patients' concerns and seek real solutions. Reduced wait times, big issue. More effective pain medication. More research that addresses patient concerns instead of things like, are women with endometriosis less attractive to their partners? They said that's not a joke. It's seriously published research. Doctors' notes should be available online through a patient portal. I could not agree more. Another person says something that I've struggled with many times off and on throughout the years of being chronically ill. It says, if you are too ill to negotiate doctors, you are screwed. Yes. From this person's experience, in the current climate, it's always to treat the symptoms rather than find the cause. That's been a lot of people's experience so far. And this person has a very interesting, if colorfully worded question. What happened to professional curiosity? They said that before their health made it hard for them to practice, they worked in the healthcare field. And the mystery cases, the ones that they couldn't fix, were the most important to them. They're the ones where you learn the most and where you are called to deep dive and build knowledge in new areas. That seems logical to me. It makes so much sense. Last comments are, when you hear hoofbeats, think horses, not zebras, is supposed to mean check the most common things first, not it's only ever horses. That critical miscommunication has led to the it's probably just issue, where healthcare providers are far too comfortable shrugging off problems until there's basically a big reason that says, oops, too late. One person's biggest frustration is that their general practitioner don't seriously consider their issues if they're not considered to be life-threatening. They just feel that they shouldn't have to be in danger of permanent injury or death in order to have their problems treated as legitimate concerns. Couldn't agree more. Do you know someone going through something similar with their doctors? Based on the prevalence of chronic, invisible, and rare illnesses? You probably do.